This patch contains two hormones, estradiol and levonorgestrel. It is used by women to help reduce symptoms of menopause, such as hot flashes, caused by the body making less estrogen. The progestin in this medication also helps reduce the risk of uterine cancer caused by using estrogen. Women who have had their uterus removed do not need the progestin and should not use this combination medication. It may also be used by women after menopause to prevent bone loss, but there are other medications that may be safer and should be considered before using this treatment. If using this medication to treat symptoms only in and around the vagina, products applied directly inside the vagina should be considered before medications that are taken by mouth, absorbed through the skin, or injected. Before you start using the Estradiol-Levonorgestrel patch, make sure to read the patient information leaflet and instructions for use. If you have any questions, ask your doctor or pharmacist. When applying the patch, make sure to peel off the backing and press it firmly onto a clean, dry area of the lower stomach. Don't apply it to the breast or on oily, broken, or irritated skin. Avoid areas where it might be easily rubbed off, and keep it away from long exposure to the sun. The patch is usually worn for 1 week and then replaced. When applying the new patch, choose a different area and wait at least 1 week before reapplying to the same spot. If the patch falls off, reapply it to a different area, or apply a new patch if it doesn't stick completely. Do not wear 2 patches at the same time. Use this medication regularly to get the most benefit from it. To help you remember, change the patch on the same day each week. It may help to mark your calendar with a reminder. If your condition does not improve or worsens, make sure to inform your doctor. Some common side effects of the Estradiol-Levonorgestrel patch, Transdermal weekly, may include skin redness/irritation at the application site, abdominal pain, nausea/vomiting, bloating, breast tenderness, headache, or weight changes. However, many people using this medication do not have serious side effects. It's important to contact your doctor if you experience any serious side effects, such as nausea/vomiting that doesn't stop, mental/mood changes, breast lumps, unusual vaginal bleeding, severe stomach/abdominal pain, yellowing eyes/skin, or swelling hands/ankles/feet. In rare cases, this medication may cause serious problems from blood clots, such as heart attacks, strokes, or pulmonary embolism. If you experience symptoms such as chest/jaw/left arm pain, sudden/severe headache, weakness on one side of the body, sudden vision changes, or trouble breathing, seek medical help immediately. While a serious allergic reaction to this product is rare, it's important to get medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist. When using estrogen with a progestin, there is a rare risk of serious side effects such as heart disease, stroke, blood clots, dementia, and cancer. The risk of these side effects may depend on the dose of estrogen and how long it is used. It's important to use this medication at the lowest effective dose and for the shortest amount of time. Be sure to discuss the use of this medication with your doctor regularly to see if you still need to use it. If you will be using this medication long-term, you should have regular complete physical exams as directed by your doctor. Before using this medication, make sure to tell your doctor or pharmacist if you are allergic to estradiol or levonorgestrel, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. It's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have a history of vaginal bleeding of unknown cause, certain cancers, blood clots, stroke, heart disease, liver or kidney disease, high blood pressure, diabetes, obesity, or any other health conditions. It's crucial to provide your complete medical history to ensure the safe use of this medication. If you smoke or use tobacco, it's important to note that estrogens combined with smoking can further increase your risk of stroke, blood clots, high blood pressure, and heart attack, especially in women older than 35. It's advisable to quit smoking while using this medication. In addition, if you are planning to have surgery or will be confined to a chair or bed for a long time, such as a long plane flight, be sure to inform your doctor. These conditions can increase your risk of getting blood clots, especially when using an estrogen product. Special precautions may be necessary in these situations. It's also important to be aware that this medication may cause blotchy, dark areas on your face and skin. Sunlight can worsen this effect, so it's recommended to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you are nearsighted or wear contact lenses, you may develop vision problems or have trouble wearing your contact lenses while using this medication. It's important to consult your eye doctor if these problems occur. Lastly, if you are going to have an MRI test, be sure to inform the testing personnel that you are using this patch. Some patches may contain metals that can cause serious burns during an MRI. It's important to ask your doctor whether you will need to remove your patch before the test and apply a new patch afterward, and how to do so properly. Remember, this medication should not be used during pregnancy, and if you become pregnant or think you may be pregnant, it's crucial to inform your doctor right away. Additionally, this medication passes into breast milk and may reduce the quality and amount of breast milk produced. It's important to consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions when using Estradiol-Levonorgestrel patch, Transdermal weekly. This can affect how your medications work and increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. There are some products that may interact with this drug, such as aromatase inhibitors, anastrozole, exemestane, letrozole, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. It's also important to note that this medication may interfere with certain lab tests, possibly causing false test results, such as the metirapone test. Make sure lab personnel and all your doctors are aware that you use this drug. If the patch is chewed or swallowed, it can be harmful. If someone has taken too much of this medication, remove the patch if possible. If the person is experiencing serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important not to share this medication with others. Make sure to schedule regular physical exams and follow your doctor's instructions for examining your breasts. Report any lumps right away and keep all medical and lab appointments. Preventing or controlling high blood pressure, high cholesterol, and diabetes can help reduce your chances of heart disease and stroke. Lifestyle changes such as reducing stress, eating a low-fat/salt diet, losing weight if overweight, exercising regularly, and stopping smoking can help. Keeping your mind active with mental exercises like reading and solving crossword puzzles can also help prevent dementia. Lifestyle changes that may reduce hot flashes include stopping smoking, dressing lightly, avoiding certain foods, reducing stress, and exercising regularly. To help promote healthy bones, increase weight-bearing exercise, stop smoking, limit alcohol, and eat well-balanced meals with adequate calcium and vitamin D. You may also need to take supplements and make lifestyle changes, so consult your doctor for specific advice. If you forget to change the patch at the scheduled time, make sure to replace it as soon as you remember. It's important not to use more than one patch at a time. Make sure to store the Estradiol-Levonorgestrel patch at room temperature and keep it in the pouch until you're ready to use it. It's important to keep all medications out of reach of children and pets. When you no longer need the patch or it has expired, make sure to discard it properly. Don't flush it down the toilet or pour it into a drain unless you've been specifically instructed to do so. Follow the instructions in the How to Use section to properly dispose of the product. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.